Today we're going to be reacting to another favorite on this channel, South Park. Yep, we're going to be reviewing and breaking down all the crazy medical type situations this show has to offer. And you know there's a lot.
School is gonna make us all get shots again, but this time it's so that we don't get warts in our vaginas. Yep, that's only a vaccination for girls, stupid.
Oh my gosh. Okay, so I'm assuming they're talking about a vaccine for girls relating to HPV, which could then turn into cancer in the future if somebody gets it. So human papillomavirus. You also give the vaccine to boys of similar age because you don't want to basically be spreading it around.
Then why are they saying that getting vaccinated at school is gonna make us all retarded? Because some people think vaccinations can give you autism or Aspergers.
Vaccines, yes, vaccines are not 100% benign, but they've debunked this topic where vaccines give autism or Aspergers, okay? There hasn't actually been any documented relationship between getting a vaccine and having autism. But in general, vaccines are quite beneficial compared to the negative aspects of vaccines.
Eric, what is it this time?
Fever, lightheadedness. I don't know what's wrong with me.
You don't feel warm.
Oh, that's a relief. I thought maybe I had a fever, but oh, my buns. There's a sharp pain in my buns.
Can you lay on your stomach?
I'll try.
There's sharp pain in my bones. Sometimes you may feel like you have a fever, but your skin temperature isn't warm. That just means your hypothalamus hasn't adjusted your body temperature. Some people actually be cold first before they actually mount a fever, just so you are aware.
Why are there hamburgers in your underwear?
Are you serious? How could there be? Oh my
gosh.
You're saying I have Aspergers?
Oh my gosh. No, it's not Aspergers, it's Aspergers. It's a good laugh, okay, totally not appropriate, but no.
Are you trying to sneak food into the school or something?
What are you talking about? I got vaccinated from the school, and now clearly I have Aspergers.
Very funny.
Well, I'm glad you think Aspergers is funny. Just note my condition on your records there.
Get out of my office.
Wow. Asperger's is on the spectrum of autism. Autism and Asperger's are neurodevelopmental syndromes. And then basically there's difficulties in social interactions and nonverbal communications.
My school teacher wanted to be a woman, and you made him into one.
Yes, he had a vaginoplasty.
There's lots of different plasties out there. Angioplasty, which is relating to like new vessels of the heart. Plasty has to do with like making new sort of thing. So vaginoplasty, you're making a new vagina.
You see, sometimes a woman wants to be a man. That procedure is called a peniplasty.
Yes, there's the opposite of a vaginoplasty is peniplasty, which basically has to do with different procedures that have to do with like lengthening a penis, making one larger, that sort of thing. So it all just depends what you're starting with, so to speak.
No, I want to be tall and black.
So you can get taller. You can have like surgical rods placed in to lengthen potential bones if you break them and have them then re-heal, but that's really not something that we do. And then can you change your skin color? I guess you can always like get tattooed. You're really not changing your skin color. Can you bleach your skin the other direction? Yes, potentially.
I hate being small and Jewish. I feel like a tough black man.
Oh my gosh, I love it.
It's a fairly common procedure, really, just the reverse of a Caucasianplasty, just like Michael Jackson. Let's take a look here.
So the reverse of a Caucasian plasty. Okay, so Caucasian meaning white, making fun of Michael Jackson and his change of skin. Now the doctor is saying he's going to reverse that. Okay, sure.
What we do is slice your face and peel it back so we can insert new pigment-producing cells inside.
What?
We break the arm bones in several places and put bracers to make them longer. Now the knees, we need to snap off and fill with small round objects that can cause better movement. And we finish it off with a nice peniplasty to enhance the genitalia.
Actually, you can rationalize like the different steps, wanting to lengthening bone, better movement of joints, and then making a penis larger because they're insinuating he has a small penis, and then doing this pigmentation changes just to the face, which then would not be appropriate because you need pigmentation changes everywhere, right?
Is this really a good idea?
Well, it's a good idea if you want to be tall and black. Otherwise, I wouldn't recommend it.
We'll give you the information that's out there and your options, and then follow it up with, do you want to hear our opinion? A lot of people don't want to hear a physician's opinion on certain topics if somebody's mind is already made up. But we're also the expert, right? So we know what we're talking about.
Well, there's no doubt in my mind, Mr. Marsh. You are constipated. Thanks for the news flash. I haven't taken a crap in over 3 weeks.
Oh my gosh. It's so common. So listening to the bowel sounds with your stethoscope, it really isn't that advantageous for us. What you're listening for is just to make sure that there's some movement of intestines. That's really all that you're hearing. Now, the pain of constipation typically comes in waves. And that has to do with the peristaltising of the intestines, or basically the involuntary movement. And it has to do with like that movement moving gas to a fixed area that's not moving, or the muscle contracting on an area that's got a ton of poop.
Well, what food have you been eating? P.F. Chang's mostly.
Eating out all the time, probably not the best thing, but P.F. Chang's good. I like their General Tso's chicken.
I'm going to prescribe a laxative. But I must warn you, when you do finally pass this stool, it might be very painful.
If you're giving something from the top, hopefully there's no blockage on the bottom. I've even had patients with something called the fecal loma. So it's basically like the massive stool ball that's not gonna move, and actually you have to have surgery to get it out. Crazy. Oh man, so painful. And man, you can cause anal fissures and anal tears, basically where your cuts around the butthole, and they're so painful. And you can get hemorrhoids, internal and external. The whole process is bad.
That has got to be the biggest crap I've ever taken.
You look at the stool, you want to look at the consistency, the color. It actually tells a lot about what your body is doing.
The biggest crap? We actually don't keep
Interested.
track of that record, sir. Because we don't want to. Look, we get calls from men all the time who believe they took the biggest crap, and we simply can't handle
Oh my
the
gosh.
measuring and verification. You need to call the European Fecal Standards and Measurements Office in Zurich.
How many guys out there are calling your buddies and telling you got a poop that's coming out the bowl, it's not in the water, it's huge, so gross, but it's just a guy thing. Let me know the longest you've seen.
Oh,
Oh,
dear.
interesting. Maybe it's Tourette's. Let's see what's going on.
It almost seems like his symptoms are like those in something called Tourette's
Tourette's.
syndrome.
It's a neurologic issue, typically with like tick movements, and sometimes there can be verbal movements with it, pretty rhythmic.
Tourette's syndrome? What is that, Mommy? Butthole! Titties! Bowels!
That doesn't seem
Right.
likely. Tourette's is a hereditary disease. It doesn't just suddenly start.
But yes, it just doesn't typically just come on, but it does show up in a young age.
On the other hand, Tourette's does often develop later in a child's life, getting progressively worse.
Oh, well, that's it! Then! Oh, Mexican stinky bowels!
There is actually no treatment for Tourette's. It's something over time that kind of is managed and then goes away.
But what about school, Doctor? The teachers and the principal, they won't understand that I can't control what I say.
Don't worry, young man. We'll make sure everyone understands your disease.
Nice, I like the doctor.
Oh, that's awesome. Thank you. Butthole!
Imagine this actually was happening in school. Yeah, so if he's faking it, it takes a lot of work to just like continually like come up with like, you know, swear words and just screaming out in public. On the flip side, if this is actually really true, this is like really tough and really hard social situation, and hopefully surround yourself with people who are understanding and educating the people around you that this is not something you're doing on purpose. Oh my gosh.
You think this is funny, you sick bastard? Cleric, calm down.
Butters,
Whoa.
what have you done?
It wasn't me. It was the ghost.
Oh, Stephen, I don't know if we should ground him or call a doctor. What do you think, Doctor?
Your son is suffering from severe dementia. He claims that the ghost of a dead friend talks to him.
Now, the doctor diagnosing him with dementia. No. Dementia itself is only really truly diagnosed on autopsy, taking a look at the brain, but there are like dementia scores and like little tests that we can do.
This is usually a sign of schizophrenia brought on by some tragic event in the child's past. I think it's best that we take him to the mental center and do some tests.
Wait a minute. You just gave him all these different diagnoses. He went from dementia to schizophrenia. Why can't the kid just have like a friend that he just has? Throwing a diagnosis on a patient and then giving medications and now putting it into a mental institution. Like, come on.
All right, Butters, just try to relax.
Oh my gosh. So a lot of times if people do have visual auditory hallucinations, that sort of thing, sometimes it's actually not mental and it actually is like something physical. It's basically ruling out all things that could be treated medically in the sense of like medications or surgeries, that sort of thing. And then once that's done, you go down the mental health, behavioral aspect of things.
Doing just fine, Butters. Just stay perfectly still now, Butters.
What?
Don't worry, Mr. Stotch. Whatever traumatized your son in his past, we'll find it.
Oh my gosh. No, we do not have machines like that. Actually, the only machine or something that we have that's very similar is like having to do with like prostate illnesses. As we get older, there's a device that goes through your perineum, and that has to do with like putting these like treatment seeds and medication directly into the prostate itself. That's how they get there. But that's not a medical device. I don't know what the device that is, but that's not a medical device. Holy cow, there was a lot to go over, a lot to dissect down, a lot of hot topics. If you guys have questions, concerns, leave me a comment below. And if you guys like this video, check out this video right here. And as always, subscribe, like, turn on those notifications. Thank you so much for watching and stay healthy, my friends.